Hi, I'm Luis. If you're looking for high-quality gradient compression socks, look no further. TXG has more than 30 years of experience designing and manufacturing medical and professional sports compression socks, and is a trusted partner for name brands worldwide. Today, TXG is on location to talk to Dr. Liu, a world-renowned cardiovascular surgeon who specializes in the treatment of varicose veins, and is here to talk to us about varicose veins and compression socks. Let us listen to Dr. Liu.
How to choose between thigh-high or knee-high compression socks? Choosing between thigh-high and knee-high compression socks for varicose veins is actually quite straightforward, since most varicose veins occur in the lower limbs. By principle, thigh-high socks are usually recommended. However, if the symptoms are isolated to the calf, or if certain work environments causes discomfort when wearing thigh-high socks, then knee-high socks may be worn instead. Typically, after treating varicose veins, we recommend patients to wear high-thigh compression socks. Women also have the option of wearing pantyhose. How long do I have to wear compression socks after surgery? After the operation, we recommend wearing compression socks 24 hours a day during the first week. Afterwards, compression socks should be worn during the day and may be removed in the evening before going to sleep. The reason we emphasize wearing compression socks in this manner is that after varicose vein surgery, whether by laser ablation or sclerotherapy, which effectively destroys endothelial cells, vessel closure requires 1 week. After the first week, the general wound should heal quite well. We should endeavor to wear compression socks for 3 months or more to strengthen the operated area and to ensure wounds heal fully. Afterwards, compression socks may be worn selectively. If the treatment is successful, wearing compression socks may no longer be necessary. If some symptoms persist or the body is susceptible to varicose veins, we will recommend continuing to wear compression socks. As the summer heat approaches, many people consider whether or not to wear compression socks. Of course, we still recommend wearing them to ensure that varicose veins does not relapse. Use compression socks made with higher percentage of cotton fiber for greater comfort and breathability. How soon after varicose vein operation can you start wearing compression stockings? Many people are concerned that the first week after operation, wearing compression socks 24 hours a day interferes with bathing. We typically treat varicose vein through ultra-minimally invasive surgery, which results in a small 2 millimeter wound. The wound is covered with waterproof artificial skin. It is very reliable. After the operation, we recommend waiting 2 days before taking a bath. When taking a bath, remove the compression socks temporarily and then put them back on after drying your legs and feet. This waterproof skin will not wash away easily. If the traditional surgery is used, however, the wounds are more substantial. This requires the patient to wear elastic bandages that can be very troublesome when bathing. Compared with a traditional surgery, the advantages of ultra-minimally invasive surgery are obvious. How often should I replace compression stockings? We need to understand that in order for compression socks to work, the socks must have elasticity, and this elasticity has a finite lifespan. It is not realistic to expect a pair of socks to last 8 or 10 years. Lycra is the material that gives compression socks its elastic property. Lycra slowly loses its elasticity over time from exposure to repeated wash cycles, to the sun, and to the body temperature. Compression socks that are worn on a regular basis should last about a year. If you alternate between multiple pairs, each pair should last about 1.5 years. How to properly take off compression socks? We should be mindful when removing our socks, especially after working a full day. At that time, the feet are full of acidic blood, which causes uncomfortable soreness. Simply removing the socks could cause oxygenated blood to rush to the feet, causing a cramp-like sensation. Let's take a very simple example. When we sit cross-legged for about 5 to 10 minutes, and then suddenly straighten the legs, we experience a numb, cramp-like sensation in the feet. This phenomenon is called reperfusion. The discomfort is caused by the release of free radicals into the muscles during reperfusion. Therefore, after an extended period of standing or sitting, we suggest elevating the feet 45 degrees for about 3 to 5 minutes before removing the socks. This allows the deoxygenated blood that accumulated in the lower limbs to circulate back to the heart and to restore blood flow before removing the socks, thus reducing the occurrence of reperfusion and improve the health of our legs. What are the main causes of varicose veins? Genetic factors play an important role in determining the type of diseases each individual is more susceptible to. Research indicates 40% of the individuals who have varicose veins have family members who also suffer from varicose veins. Humans are the only animals that have varicose veins. There is a causal relationship between standing and varicose veins. People who stand for long periods of time are more susceptible, such as soldiers, department store counter workers, flight cabin crew, and teachers. In addition, obese individuals and women going through pregnancy are more likely to have varicose veins due to high pressure in the abdomen, which slows blood return in the veins. Which hospital department treats varicose veins? Is there a cure? If you suffer from varicose veins, you must seek help from a professional vascular surgeon. 20 years ago, varicose veins were treated through general surgery. But with the advancement of medical technology, we now recommend professionals who specialize in varicose veins. So, can varicose veins be cured? Basically, yes. If your treatment is successful, then of course it is possible to cure. A radical cure promises the symptoms will not happen in the next 10 or 15 years or for life. In the case of varicose veins, within about 5 years of our treatment, if there is no relapse, it means that you had a radical cure. What are the symptoms of having varicose veins? Everyone's condition is different, but typically varicose veins exhibit one of these symptoms: soreness, numbness, heat, bloating, itching, and pain. Soreness in the feet often results from standing for a long time. This is very uncomfortable. Numbness. Everyone should be clear on this. Heat typically happens in the afternoon, when one feels heat starting in the sole of the feet, rising up slowly to the calf. The feeling is very uncomfortable. Bloating typically occurs in the afternoon, giving a sensation that is difficult to stand. Itching feels like ants are crawling on your skin, but in fact it is the result of reperfusion, which releases free radicals that upsets the balance of the skin. Pain is less common. A small percentage of patients experience stinging sensation. Of course, if it is varicose vein symptom, patient will also have another complication called thrombosis, the clogging of blood vessels. This causes pain and inflammation. Pigmentation occurs in the late stage of untreated chronic venous circulation problem. It is similar to dirty sewage. When hemoglobin releases from blood to the skin, pigmentation results. As conditions worsen, this eventually leads to skin ulceration that does not heal. The end result is vein ulcer. These are typical symptoms of varicose veins.
Finally, thank you for watching our video. If you have any questions about compression socks, please feel free to contact us.